Good morning, good afternoon, and good evening, and welcome to yet another edition of the Pure Digital Passion Podcast with me, Moses Kimibaro. Today, I have with me Cynthia Kahumbura and also Jay Patel from Jacaranda Health, who are doing amazing things using technology in areas such as maternal healthcare and also for newborns. Thank you very much for joining us today.
Thank you for having
Thank
us,
you
Moses.
for having us.
So, Cynthia and Jay, maybe we can start with you, Cynthia. You can tell us a little bit about yourself and also the role that you serve within Jacaranda Health.
So I'm Cynthia Kahumbura, and I'm a co-executive director at Jacaranda Health. I started at Jacaranda Health in 2020 as director of operations, and my objectives then were to see how we could scale our innovations, and from there see how can we go national. Through the years from 2020 to 2022. We moved from 5 counties to actually 22 counties.
Wow.
During the pandemic. So that was a very interesting time, but we were able to do that by being able to adapt very quickly and using our technology to ensure that we were reaching moms and healthcare providers during that time. And now my objectives as co-executive director is to really focus on Kenya and see how do we scale nationally? How do we ensure that in 10 years' time, every mom or caregiver has access to prompts and it's the norm and is able to actually receive information as well as ask questions and walk the journey of pregnancy and postpartum alongside them.
Fantastic. Jay, maybe you can tell us a bit about yourself and your role also at Jacaranda Health.
Thanks. So I'm Jay Patel, Director of Technology at Jacaranda Health. I joined about 5.5 years ago. I was the first member of the tech team and have grown with the organization, have grown the team itself. We're now 10 people and we manage the organization's technology and data infrastructure, which includes the messaging platform, the help desk, all of our AI work, and kind of the glue that combines or makes all of these things work together. I myself am third generation Kenyan and happy to say that, and really proud to say that our entire tech team is 100% Kenyan.
Fantastic. So I'll have to come back to you again. Maybe you can tell us a little bit more because you came into the organization at a fairly interesting time with COVID. We know that for many organizations and many people, that was really the digital transformation moment.
Yes.
And I'm just trying to get a sense of, as an organization, how did that impact you? How did it affect how you currently engage your stakeholders? But more importantly, clearly, this has become a bigger part of what you do today. So maybe you can take us through that journey and that transition for yourselves.
My journey, my personal journey is interesting. I joined Jacaranda, and 1 week later, the lockdown happened.
Wow. Perfect timing, huh?
Perfect timing. But we had to, we saw the need. I mean, everyone was impacted by COVID. So we saw the need and we looked at what do we have internally and how can we support a health system that is going through a challenge that they've never experienced before. And because our platform was already their prompts, we were like, let's add content around COVID.
Okay.
COVID during pregnancy. What are the things to do to look out for? Which facilities can you go to? Because some facilities were also closed.
Yes, of course.
Or COVID-specific facilities. So
Yes.
which ones can you actually receive care at during this time? And being able to walk the journey with the mom at that critical time also led us to understand, okay, we need to make sure we're reaching more moms. And the counties that we were partnering with were also asking us to scale and sharing with their other peers, reach out to Jacaranda. So that's one of the adaptations that we made and with our technology and also our reach. And from our other intervention, which also is about training, upskilling midwives and nurses, because they were in the facilities, and our teams, our lead mentors, were supporting them a lot within the facilities, we couldn't visit anymore. Therefore, we actually started looking at how can we support them from a digital perspective. So we used a lot of WhatsApp and Telegram.
Okay.
to ensure that the content was being delivered as it should be at the facilities, that they were still meeting. We set up Zoom calls. So we were still supporting them remotely, but ensuring that they're still receiving the content, they're still receiving the support, while also providing them with COVID-19 information as well. So we looked internally, and we had people like Jay and the team that had grown at that point, and said, how can we iterate and adapt to the environment that we were in? So it was an interesting time, but we were able to really shift things and understand also the power of technology and how we can utilize it to actually impact outcomes and moms and babies' journeys.
Okay. I want to go a little bit further, maybe for the benefit of our audience, to better understand what prompts actually is. Because I know that also it predates the AI era, it predates a lot of the things that you're doing today. And how is it, what is it? And then, of course, how does it fit into the broader Jacaranda Health agenda as an organization?
So at Jacaranda, our vision is a world where all moms are able to deliver and safely and with dignity, and all newborns have a safe start in life.
Okay.
And our mission is to really do that in partnering and co-designing with governments.
Okay.
Why? That's where majority of moms deliver, in public facilities.
Of course, public health care, yes.
Yes. So there was a confidential inquiry that was done in Kenya, and we recognized that, and it came out that 33% of moms, maternal mortality is happening because moms are receiving care late, either at the wrong time or at the wrong place. So when we recognized this, we said, how is it that we can be able to ensure moms know when to seek care and where to seek care? And that's where we developed our AI-enabled digital platform, Prompts. And this is really a chat service that's available on SMS, where moms receive information based on their specific gestation period or during postpartum. And then they're also allowed to to ask questions. So it's a two-way service.
Yeah.
And through that, now we're able to walk the journey with moms. So some of the gestational messages, for example, are, it's 5 months. You should be able to feel your baby moving. What happens? We get moms asking questions about nutrition. And then we also help moms remember their appointments. So your appointment is coming up. Make sure you go. This and this and this should happen in your appointment. And then we also follow up to make sure that, did you go? If you didn't go, why not? Okay. Make sure you go again. So in that sense, that's really what Prompts is. And it's about walking the journey with moms. Additionally, as we saw when it was a two-way system, we recognize that we can also ask moms questions about the quality of care they're receiving. And this is really critical because we're saying, yes, go for your ANC or PNC visit. And we've made sure that you went, but were the right steps taken? Did you get your blood pressure measured? Did you have a danger sign discussion? Abdominal exam? And we're actually able to capture that information as well and feed it back to the facilities. One of the biggest areas we looked at was around respectful maternity care. So we ask moms, were you treated with respect? We define respect also.
Wow.
And then you'll hear mom say, yes, I was, or no, I wasn't. And the answers can range from, there was a long waiting time to abuse.
Wow.
Yeah. And we feed that back to the facilities, to the county health management teams. And we've actually been able to see a big shift in how the facility managers and teams are taking this data, this information,
Yes.
and changing what is happening in the facility. If you'll allow me to give an example.
No, please.
In Nairobi County, there's a health nurse who asked about, was noticed that moms were not coming for their visits. There was a decline. And through the feedback that we were giving her, she recognized that there was a shortage in, she recognized that there was an issue in long waiting times and moms saying that they didn't receive certain commodities. So she went to investigate within the facility.
Yeah.
Why are there long waiting times? And she found there just weren't enough nurses during prenatal, during the ANC clinics to get things moving. And also around, moms are coming waiting and they don't know who's next, who's this. So she very quickly did a staff rotation and actually put it up on the notice board. So everyone is clear. You are here from 8 to 5. You are on this shift. You are on this shift. She also introduced a ticketing system.
Wow.
So moms know, okay, I'm number 10. That means I'll actually wait for about an hour instead of sitting there and being like, what, has my name been called? Has,
Yeah. It's a bit more responsive. It's a bit more anticipatory as well.
Exactly.
Yeah.
And then for the commodities, she actually took that that data and went back and said to her managers and said, look, moms are not coming here because these commodities are not here. So they make the visit and yet they're not able to leave with what they need to. And that actually got funds and was able to get additional commodities.
Fantastic.
This actually led from an increase within 3 months, of from 42% attendance to 84%.
What?
Just within 3 months. So, people always think data's huge, but just that information and that feedback from the client themselves can actually change how quality of care is being delivered and services are being delivered.
Fantastic.
So that's really what the prompts our platform is able to do.
She's doing a lot of things, but I feel like one of the key things it does is it gives the voice to the mother. It gives them a chance to be heard, and input is also then critical in how care is delivered, right?
Absolutely. I mean, there's suggestion boxes.
Wow.
You can give feedback. The nurse can ask you, how was it?
Wow.
But maybe you're not comfortable to give it there, or, you don't want to have the time to write it. But when you're at home and on your phone and someone is chatting with you, how was it? Did this happen? Were you treated with respect? Those are that is it. It's really going to the client and meeting them in their space.
Fantastic.
And in terms of cases of abuse, we actually know there's a facility in another county that we work in where one of the facility managers was so shocked about what was happening that they investigated and actually took measures against that nurse.
Wow.
They also used our mentorship program, which has a module on respectful maternity care.
Wow.
And making sure that everybody knows what is respectful maternity care.
So it's not ambiguous at all, huh?
Not ambiguous. There are courses on it because a mom is delivering. She does not need to be abused at that time.
It doesn't need the extra stress. That's already a significant step as it is.
Yes.
Jay, I'd like to come back to you. And I think for me, and this is now for the techie in me, I really want to hear about the journey on the tech stack. How did you build these platforms? What's been the journey so far since you joined Jacaranda Health? And I think even above and beyond prompts, looking at the broader organizational technology setup, what have you been doing there, and how has this progression been to date?
When I joined in 2018, we were sending out messages on an off-the-shelf kind of messaging platform.
Okay.
It was expensive. It wasn't very flexible. And part of my job was to figure out what's the way forward.
Yes.
If you're getting 100 questions a day, it was good enough. At our scale right now, we're getting almost 6,000 questions a day. That platform wouldn't have been good enough. So over the years, we've kind of iterated, tried 2 or 3 different things, and we've settled on like an open source messaging platform, which is very robust and is able to meet the needs of the program. If the program comes and says, okay, I want to ask this mom this other new question, it's very easy to set it up and also do some A/B testing to see how does the mom respond? What kind of question does she respond to better? Now we're spending probably 90% less than we were on messaging costs 5 years ago. And we've also incorporated AI to help triage the messages as they come in and to help personalize the user's journey, all with the hope of improving health outcomes for our users.
When we talk about reducing the cost by 90%, how is that actually achieved?
Most of the costs are SMS based.
Okay.
So as you scale, you can get economies of scale. So you can remove the middlemen progressively and connect maybe directly to the telco as opposed to, having 2 or 3 layers between you and the telco. So when you do that, you get also bulk messaging rates. And then when you're building your infrastructure on the cloud, and you're spreading the cost across millions of users as opposed to thousands of users, you can take advantage of that scale and really reduce the cost.
Yeah. Now, one of the reasons I really wanted to have this conversation is that right now, I think like many of us, we're attending events, conferences, reading about AI everywhere. It's the hot topic that all of us are hearing. And I think for me, what really intrigued me about prompts and what Jacaranda Health is doing is that this is happening right here in Nairobi, in Kenya, that you're deploying this, state-of-the-art AI platform, but again, delivered using SMS, which is a common denominator for every phone today, whether it's a smartphone or a basic feature phone. So I'd like to maybe understand a little bit about, what has been the implication or the impact of using generative AI. I know that you're working with platforms like Llama, which is from Meta. I think earlier we spoke, you also use, I think, Google Gemini to some extent. Can you talk a little bit about that architecture and also how you went from not having AI to also training the platforms? I think many of our audience would appreciate understanding that journey. And I know it may be getting a little bit technical, but I think it would be interesting so that people can realize this is not rocket science. This is something that, even they in their own organizations could possibly also do something similar.
Yeah. So when I joined, we had one help desk agent. She got 100 questions a day. If question number 40 was an urgent question, she could just scroll through them as they come in, pick out the one that was urgent, and fire off that answer.
Okay.
At our scale now, 5,500 questions or 6,000 questions a day, we have 18 help desk agents. You can't assign anyone to look through these manually. So as we were growing, the need for some sort of automated triage came apparent. And so we started experimenting with off-the-shelf tools. How can we use AI to sort these messages as they come in? A common question we get is, can I eat avocados when I'm pregnant? So that will be flagged as a nutrition question under avocado. And then, of course, that's a low priority. If we take a few hours to answer that, the mom's not going to, it's not going to impact her very in any way. But only about 2 or 3% of the questions we get are urgent. So I'm bleeding, I have a severe headache, my legs are swollen. You need to float these to the top and make sure these get answered immediately. And that's what the AI helps us do, is kind of just pull these questions out of the queue, get them the help desk attention, and make sure that the help desk can follow up with the mom. If necessary, they'll call her and say, go to a hospital, get the care immediately.
So really escalate it to that point where you intervene and instigate the next step as well.
Right.
Okay.
So that was step one. And what we tried to do is, if a mom asked a certain question, we'd pull out what we call the intent, so avocado or bleeding or headaches, around 200 intents, and try and match it up with a pre-written response from our database. So just every avocado question with the same avocado answer. But with the advent of tools like ChatGPT, you can actually answer these questions much more personally, much more contextually, and improve the user's experience. And we did try ChatGPT. It was surprisingly good in Swahili. But for our context, where moms are texting us not in university Swahili, but in informal Swahili, there's a mixture of Swahili and English and Sheng. People are using feature phones, so they're using abbreviations a lot.
Oh, okay.
ChatGPT fell down very quickly. An example is that a mom had asked a question about fetal movement. So like a baby kicking, for example, in the abdomen. ChatGPT ChatGPT thought it was a question about a baby playing.
Oh.
So those kinds of errors used to happen quite frequently. And we decided, let's see how we can do better. And so we took Llama, Meta's Llama 2 model. We have a database of 1.3 million questions that moms had asked us, mostly in Swahili, and the answers that our help desk has given. And we just kind of trained Llama first to understand Swahili, the word associations, and then to be able to answer these questions. But and that's what we're putting in place now. But it's important to note that we don't want the machine, especially like a generative model, speaking directly to moms. These things can be unpredictable. So what we're doing initially is a mom will ask a question, the model will create an answer, and then the answer will go to the help desk. The help desk, there's the human in the loop, deciding that this response is good. Let me just send it out as is. This other response needs editing before I send it, or maybe I just throw this other response away, write my own. We want to make sure that moms are getting information accurately, fast, but most importantly, in our context, if we give a wrong answer, it could potentially lead to adverse outcomes. So, efficiency is one thing, but safety above everything else.
Fantastic. I love the fact that there's this element of moderation, because this is, maternal health, and we're looking also at newborn health. We don't have the luxury of getting it wrong, do we? And the human element becomes critical, right?
Yes.
Yeah. So I'd like to come back again to you, Cynthia, maybe thinking a little bit about, again, the healthcare providers, and I guess at the county level, and all. You said 22 counties plus now?
23, yes.
23 counties. And I think earlier in our conversation, you mentioned that there's about 2.8 million mothers who are using PROMS, correct?
So we've since we started in 2016,
Yes.
we've reached 2.8 million mothers.
Okay.
And for example, in 2023, we reached over 600,000.
Okay.
So for example, a mom who joined in 2020 is
Now has
the
a
baby
toddler or
is
something,
grown,
yeah.
is grown. But she may come back if she has another baby.
Correct.
Yeah.
Correct.
So annually, we're at about 600,000.
Fantastic.
Yes.
Now, this is very interesting for me, because there's obviously, I'd almost call it the go-to market. How do you actually get PROMS out there? And what has been the reception on the ground in terms of utilization? Because we also know that a lot of people sometimes are a little bit averse to using technology for such things. Have you faced any unique challenges from that point of view? But let's like to understand a little bit more about how you take it to the market, and then get it to the mothers who need it, and then obviously how you work with the various partners at the sort of healthcare facility level to get it to them.
Yeah. So how we reach moms, essentially, what we've seen work is really through the healthcare worker that they meet at the facility. That's a trusted partner. That's someone that they know. And they actually have been the biggest champions in getting moms onto the platform. We've also worked with CHPs as well, and we continue to work with CHPs. They are also trusted community members. And how so that's how we actually get moms onto the platform. But first, before we even go to the facility, we must work with the county government. We do not believe, as Jacaranda Health, we do not believe in just coming into the county, doing our thing, and this is your county. We will work with you. Where do you see the biggest need? What is the biggest value to you? How can we complement the work that you are doing? Because we can't be an alternative either. So really, what we look at as well is how do we co-design with the healthcare worker and with the county health management teams. So we are always, as Jay mentioned, we do A/B testing. We also involve the counties in this, and we update them. Okay, we saw this. This is how we're going to proceed. When we're looking at, okay, we're maybe in this facility. Is there a need in this other facility? Because this other, like let's say this level 3 facility is feeding into this level 4 facility. Do you need training for your healthcare workers here? Because then it will help triage how moms and babies are being referred to the level 4
Correct.
facility. So we really, our main partners are really county governments, and seeing then also what we're seeing from an implementation perspective, how then can we bring this back to national government as policies and guidelines are being developed? Because, you can have a policy and you can have qua ground.
The actual facts. Huh?
Yeah. So it's really, how do we make sure that the ecosystem is working? So those, and as I mentioned, we co-design. We also co-design with moms. We do work, when we were starting out, we held a lot of focus group discussions. We also do biannual surveys where we reach out to the mom and we get feedback on prompts. How is it working? What would you like to see more of? What would you like to see less of? And we iterate and ensure that what we are providing is not what we think, but what is really going to help the mom, the healthcare provider, and the health ecosystem in ensuring that quality of care is being provided. In terms of other partners, we also work with private sector partners.
Okay.
And we look at one of our projects is really supporting a private insurance company and seeing how is it that we can shift behavior of health-seeking behavior of a mom, and then also quality of care at the facilities to ensure that they're getting value-based care, where providers are not paid just on this is the service, this is the transaction, but is the quality of care being provided actually real quality and leading to better outcomes.
This is interesting. So it's not just the county governments and sort of the public health system, but also private sector also seeing benefits to using prompts.
Yes.
And I'm also curious because there's something you said earlier that caught my attention, which is you work with the county, you co-create. Does that mean that even within the way that it works, let's say at a county level, there's sort of variations or customizations you're able to bring into the platform?
Yes. So for example, in Western Nyanza and coastal areas, there's a higher prevalence of malaria.
Of course, yes.
So really ensuring that, especially within those regions, that pregnant moms are receiving information about malaria. Also in other regions, there's a prevalence of HIV. So our moms also being able to receive information around that. Those are also areas that we're trying to grow our content and looking to partner with other development implementing partners in you're reaching the same mom
Yes.
that we're talking to. How is it that instead of us going all 10 of us, how can we then reach the one mom in a way that she's receiving all the benefits from everyone, but we are through scaling sustainably, ensuring that every mom is receiving the support that she needs.
That's fantastic. So it's basically prompts can also be contextually
It can be
relevant for that
contextualized.
market. Yeah.
Yes, yes.
Jay, I'd like to come back to you and talk a little bit about maybe thinking about sort of the infrastructural considerations, obviously the bias and the ethical issues around using AI. I don't know to what extent that becomes an issue given that you're deploying it using SMS, and very happy to hear that it's available also in Kiswahili and Sheng. But are they infrastructural considerations in order to run and build a platform like Prompts to run in an effective way?
From an infrastructure perspective, first and foremost is, of course, data protection. Start with the mom, making sure they consent, and it's an informed consent. They know what they're consenting to. They know, for example, that the service is backed by artificial intelligence. But how, when you're speaking with a rural mom who may or may not have finished high school, how do you even bring up the word artificial intelligence? So there's those kinds of design considerations. Once the moms have consented, then we're luckily able to take advantage of cloud services, which offer these infrastructure at scale and offer these services at an affordable level that we can actually reach millions of moms, not only in Kenya, but in a couple of other countries across Africa, and able to reach these users in their context, in their language, with a service or messaging which is specific to them, and not just, it's not a one size fits all.
Fantastic. And when you think about sort of the way forward around the utilization of AI and this sort of technology, thinking maybe 5 years down the road, what do you see happening, Jay, in that context? I mean, the platforms are becoming very powerful. We saw even recently with ChatGPT launching 4.0, we saw the new Gemini 1.5. We're seeing incredible capabilities coming to these platforms. What do you think you see as sort of the evolution of prompts going forward from that perspective?
I think we're getting to a place that even a year ago wasn't really thinkable, where you can personalize a service for every single mom. So what we have been doing is when a mom signs up, we'll send her a standard set of messages. These are the types of foods to eat, foods to avoid. This is what to do in case you detect, or this is what a danger sign looks like and what to do in that situation.
Yeah.
But how do you, for a mom who has diabetes, that message, that nutrition message might need to be changed for someone who has diabetes. It may be different for someone who has anemia.
Wow.
A different message may be relevant or irrelevant for someone who has HIV. So with LLMs, like we're experimenting now with Gemini 1.5, can we take these standard messages based on what we know about the user, offer a much more personal and much more contextual service, so that the idea, or what I'd like to envision, is that the mom thinks she has her own friendly nurse who's on the other side of the phone, who knows her journey and who can offer personal advice. And that's starting to become possible. The other thing is new channels like voice. How can moms, low literacy moms, interact with the service and get the benefits of the service beyond text? Can they text in or just send us a voice message, and then have someone respond immediately, or have the help desk flagged and call them in case of an emergency? A very interesting idea I heard just the other day is, can a mom send a photo of a plate of food, and then the AI will see, okay, you have these food groups, but maybe you should try adding this. We haven't tried that, but I think it's soon becoming possible. Yeah.
Yeah. Cynthia, when it comes to scaling up, utilizing technology, again, coming from the journey you've had with, the COVID period and where we are today, what have been some of the challenges faced in sort of growing the business, or rather growing the organization around the use of technology in terms of your operations and your activities as in terms of what you do, so to speak?
Sorry, can you repeat the question?
Yeah, what I was asking is, when it comes to scaling up the use of technology, since, of course, the journey from COVID to date, I think the intensity or the utilization has been significant. What have been some of the challenges in doing so, in getting to this point?
So well, so just to be clear, the question is scaling technology,
scaling up, and the challenges faced, rather the challenges faced in doing so.
Okay.
Yeah.
So as you look at scaling, the challenge with scaling is always ensuring that you're doing it in a sustainable manner, because you can't scale with very resource intensive, and then money runs out. So how do you keep going? And as one of our foundations is always ensuring that we have what we call low cost or affordable solutions.
Correct.
So whenever we're looking at, okay, we've moved from 100 questions per day to 5,000 questions per day, we always look at, okay, what will this look like if we're going to invest in additional technology? How are we maintaining the cost of per mom on the platform?
Correct.
For the lifetime, basically from when she joins to 1 year postpartum. So as Jay mentioned, that's how we got also into AI. It was not sustainable to continue the way we were continuing. So it's not just about efficiency, but also cost efficiency. So really ensuring that we're able to leverage the the technology that's there, but making sure it's still affordable. Right now, for a mom, the cost of being on the platform for SMS is free.
Fantastic.
And that's something we categorically want to maintain, that we bear the cost. But then how do we also make that sustainable? How do we make it sustainable for the mom to get enrolled? So always looking at what are the cost drivers and how do we drive them down? So I would say it's a challenge,
Yes.
but it's a good challenge to have because we keep our focus on how do we ensure that this can reach every mom and baby.
Fantastic. Jay, I understand beyond Kenya, I believe Prompts is now going beyond our boundaries, beyond what we are. Can you tell us a bit more about that in terms of how you're then making it a more possibly Pan-African, possibly a global solution that can be used for these particular use cases?
So we have partnered with the Clinton Health Access Initiative in Eswatini for a small immunization pilot, which we're looking to transition now to the Ministry of Health. In Ghana, we've launched a more full-blown implementation of prompts. So a lot of the challenges were around language. In Kenya, you have Swahili and English primarily. In Ghana, the languages are much more fragmented. There's no real dominant language as such. Swahili has a lot of training data for language models. Ghana in Twi, you don't have that so much. You don't have machine translation, for example, with Google Translate or effective machine translation with LLMs. So trying to figure out how do we expand the services and make them available to users in these other countries, where the context is different, where the language is different, where the language resources are also different. And that's been a learning curve. And then, of course, how do we set up our infrastructure to be able to handle all of the traffic from multiple countries? We're talking to partners in South Africa, potentially Nigeria. So the same questions, right? How do you adapt the service for local context? And then how do you build language models or AI to work with these local languages?
Fantastic. Cynthia, lessons learned. Thinking now 4 years on, all the things that you've done, and particularly around prompts. What are some of the lessons learned in terms of deploying this technology and things that maybe you anticipated, maybe things you didn't anticipate? What has been some of the learnings along the way?
Mm. So I think from a lessons learned perspective, it's really to look at being able to move quickly,
Yes.
but if effectively, because this is health we're talking about, and learning to keep up with what's happening in on the ground in context, as well as what's happening in the digital space.
Correct.
So ensuring that we had the Data Protection Act also
Correct.
launched. How are we making sure we're in line with that? What we were doing before may not work with what we're doing today. So really ensuring that we are aware and keeping track of what's happening on the global arena, the national arena, and merging it with also what's happening on ground. Yeah. I think another lesson learned, or something that we ensure is part of our DNA, is testing. Always testing and iterating and adapting. We have to be flexible because what was working in 2022, in 2023, may not be what is needed in 2024. The world is constantly changing. So let's ensure we're testing, iterating, and adapting.
Yeah.
Yes.
Jay, what about you? I mean, I think for me, what is so inspiring, I think, about prompts and what Jacaranda has been able to do is you've taken this whole incredible subject matter called AI and you've brought it down to a very pragmatic and practical level where mothers are getting the benefit of this. Now, there could be many other use cases and many other scenarios, possibly even commercial or also in a healthcare type scenario as yourselves. But from a technology standpoint, right, what are some of the things that you would suggest or recommend to organizations that might want to do something similar to what you've done? Are there any things that, some takeaways you think that would be important for them to know?
Design and build fast and launch fast. So don't spend months thinking about every possible permutation or iteration of your product. Just get something out there. The users will tell you what they need, and you will learn and iterate much faster just based on user interaction with your service. Secondly, don't try to, for example, we had good reasons to build our own language model. Don't go that route unless unless the off-the-shelf tools are absolutely don't work for you. In our case, the accuracy of the output accuracy of the output wasn't good enough, so we had to bring it in house. There's cost considerations, privacy considerations as well, and then just keep, as Cynthia said, the world is moving fast. These technologies are evolving so fast. Make sure that you're building for context. What worked last year may not work this year or next year, and make sure that users' needs are kept in mind. You reach them where they are, not where you are, or where you want to be. Their language, their access to technology. In our case, we don't want the service available only to people who can afford smartphones or WhatsApp. It has to be available to everyone. And SMS, like you said, is the lowest common denominator there.
And just to add on the lessons learned, when you're looking at scale, as I mentioned, you test, iterate, and adapt. People can say, okay, we've gotten this new version of the product. Let's launch it. If you're at scale already, you test it and iterate and adapt to the small before you scale it. Because you can be like, oh, we've done it so well. We're at scale. We're releasing version 2.0. How, let's test it and iterate it at scale. So I think that's something that not only did I learn at Jacaranda, but through my career, is start small, then scale it up to understand how users are using it.
In fact, when you use the words A/B testing, I was doing a little happy dance because that's something that often when we see technology products built locally, the assumption is it's good enough to launch and no one really has tested it. And then, sometimes you find there are problems that only become apparent after the fact because you didn't test with a smaller portion of your audience.
Yes.
I think as we come to the end of our conversation, I'd just like to maybe ask, given what I believe is such a noble focus behind what Jacaranda Health does, for our audience and anybody who's watching or listening this, how can they possibly participate, be a part of, maybe support what it is that Jacaranda Health is doing on the ground?
Yeah, so I think we encourage all moms, caregivers, babas to enroll onto prompts. And it's just about sending either mama or baba to 21884. And that's of course direct to that audience, but we're also looking at other county governments that we're not in, national government, other development partners.
Okay.
Let's work together. Where I always say it's one household, it's one mom. Let's see how we can work together to reach that one mom, to support that mom and baba through their journey as well. So we're always open to having discussions, partnering, and seeing how do we do this, because no man is an island.
Correct.
Yes.
It's all about partnering and working together.
Absolutely.
At the end of the day.
Yes.
Jay, do you have any parting shot, anything else you'd like to add to your comments?
Cynthia said it better than I could.
Yeah? Okay, great. Yeah. So thank you so much, Cynthia and Jay. It's been a pleasure. And I'm really hoping to see more and more about what Prompts is doing and achieving on the ground. And somebody who's really keen on AI, I'm so delighted to hear that, this is something that many can do, but also there's a practical and sort of viable way of utilizing AI for use cases such as these. And more importantly, I think it can also inspire others to see how they can adopt this technology for all types of use cases that could help the community at large in different ways. And once again, thank you for joining us for this edition of Pure Digital Passion with me, Moses Kemibaro. And more importantly, I hope you've learned something interesting around the practical use of AI within a healthcare sort of a use case right here in Kenya, and now also being exported to other parts of the continent. We'll catch you in the next one.